Welcome to SafePoint. My name's Alexis Erickson, Program Coordinator at the Windsor-Essex County Health Unit, and I'm happy to be taking you on a tour. SafePoint is a health service that provides a safe space for people to consume pre-obtained drugs under the supervision of medical staff. At SafePoint, we provide a wide range of comprehensive, compassionate, and evidence-based services that meet folks where they're at in their journeys with substance use, wherever that journey may be taking them. We know that services like SafePoint help to save lives and can have many positive impacts on not only people who use drugs, but also surrounding communities. And for that reason, we're pleased to be working alongside our community partners to bring this important health service to our community. Clients enter the facility through the main entryway located at the east side of the building and signal to staff that they have arrived by ringing the buzzer installed next to the main door. Once the buzzer is pushed, the client is greeted by our reception staff by speakerphone. Reception will confirm the purpose of the client's visit and proceed to buzz them into the vestibule area where their journey within the site begins. The client is then welcomed into the site by our reception staff. In the vestibule area, we have lockers available for clients to store their personal belongings during their visit, such as backpacks, duffel bags, and other small items. These items are stored securely while the client is utilizing services and are picked up by the client as they're exiting the facility. Once any personal belongings are stored, the client is then guided to our reception desk, where they undergo a brief intake and assessment process with one of our peer in-reach workers. At intake, we collect information such as client demographics, relevant medical history, and the client's planned substance use for the day. Clients do have the option to remain anonymous at intake and throughout their entire care experience at the site. They're also not required to provide a health card or any other form of identification to utilize the service. And that helps to ensure that our clients' needs for privacy are always at the forefront of care, and also helps to foster a low barrier service for our clients. If all of the consumption booths are occupied at the time of the client's arrival, they're asked to take a seat in our waiting area where they can relax and watch television until a booth is ready for them. A security guard is also stationed at the reception desk during all operating hours to ensure that the safety of clients, staff, visitors, and the surrounding area is maintained. After intake, the client makes their way to the consumption area where they're greeted by our registered practical nurses who work in the space. An RPN provides the client with the harm reduction supplies and equipment that are required to use substances on site, such as new needles and syringes. SafePoint partners with the Positive Pathways Community Services Needle Syringe Program to make these supplies available to our clients. In this space, clients also have the option to participate in drug checking services. Drug checking allows clients to test their drugs to see if they've been contaminated with any other harmful substances, such as fentanyl. And from there, using the results, clients can make informed, on-the-spot decisions about their substance use that may reduce their risks of overdose. Once the client has been provided with their supplies, an RPN assigns them to one of 4 consumption booths to consume their substances. Clients are permitted to use their substances in the consumption area either through injection, intranasal, or oral use. While the RPN supervises the consumption, they make themselves available to educate clients on ways that they can use in safer ways or to reduce their risk of harm. The RPN will also provide emergency medical care and overdose response services to clients as necessary. Once the client is finished with their consumption, all of their supplies are discarded in the needle disposal bin available at their booth. The client is then encouraged to remain in their booth or in the post-consumption area for about 30 minutes so that they can continue to be monitored by medical staff. Couches, a television, refreshments, and snacks are available in the post-consumption area to allow clients to recover comfortably as they prepare for discharge. At this time, depending on the client's unique needs, goals, and stage of recovery, they may wish to engage in conversations with staff about accessing other forms of wraparound care available at the facility. Connections and referrals to substance use treatment, mental health services, primary care supports, and other social services are also available for clients who are looking for other supports. SafePoint partners with community organizations across Windsor-Essex County to offer these services to clients. There are multiple private office spaces built into the facility where service providers can meet with clients to offer various forms of wraparound care. Medical staff at the site are also available to meet with clients in our RPN office, where basic forms of medical care can be provided, such as wound and abscess care, first aid, foot care, and other supports. Medical staff can also connect with clients in this space to assess any other health needs that they might have and to ensure that they get linked with the appropriate health services. Prior to leaving the facility, clients can also be provided with harm reduction supplies and educational resources to take away with them, such as safer drug use kits, needle disposal bins, and drug test kits. Naloxone, a life-saving medication that can temporarily reverse the effects of an opioid overdose, is also offered to all clients as they're leaving the facility. Once the visit is complete, the last service provider to interact with the client guides them back to the main doorway for exiting. Our reception staff check in with the client before they leave to make sure that they got what they needed out of the visit and to wish them well. Thanks for joining in on the tour. For more information about SafePoint and the services offered, you can visit our website at wecos.ca. You can also email us at ctsquestions@wechew.org to ask any questions that you may have.